Hello and welcome again to our Thursday Live. This is Dr. Jerry Dreessen, and we are going to be talking about our series, or continuing with our series, our Ask Dr. Jerry. And this one specifically is number 6, which is consistency is the key. And as far as our best practices series. So, with that, I'll jump right into it. Also, those of you that are watching live, feel free to comment down below. Right after this presentation, I'll be jumping into the members only group. If anybody has any questions that they have that they'd like to have answered, we can definitely take care of it there as well. So, with that, let's jump in. First of all, my question is, when you are using PEMF, what's the goal? What's the goal for PEMF? Are you working on wellness? Are you looking for changes? That kind of determines whether, what your goal is as far as putting together sessions and things like that. So, is it that you want somebody to just feel good, or you want to actually get in there and change some things, some structures? If you want to, work on healing bone, if you want to help with PTSD, if you want to take their current situation and change it to a different situation. And what that means is you have to record what the beginning looks like, because if you don't do a pre-test or an initial exam of measurements, range of motion, pinwheel tenderness, things like that, if you're not gauging that information, then after you've done a few sessions, how are you going to know it's better? And that's kind of where you run into placebo. It's like, how do you feel? I feel better. Okay, they say they feel better. That's subjective. If you want objective data, then you need to collect it, because with them, they may be saying, I don't feel the difference, yet you've measured their arm, it's skinnier because the swelling's gone. You've done pinwheel tests, they've got more sensitivity. The range of motion in whatever joint you were working on is better. All of those things have to do with recording what you've got going on. So the proper positioning and placement is one of the ones that we talked about last time. And that's really key for, this whole situation moving forward, is to make sure you've got it in the same spot every time. If you really want to track these things, if you're just doing an omni type of session where you're placing on different parts of the body, then you're more on a wellness, having them feel better. But if you've got a fixed focused problem, then you want to key in exactly what we talked about last week as far as proper placement, what attachments you're using, things like that. So let's talk about some words. What does consistency actually mean? What's your definition of it? What's, the whole process? And is it a matter of, what it is that you're doing? And I think it all boils down to, the mechanism of injury. And if there is an injury, and again, if it's just wellness, it's like, hey, I want to try out this PEMF machine just to see how it makes me feel. And for a lot of people, it changes. It'll change their day. They'll feel better. They'll stand up. They go, I don't know what's different, but I feel different. Those are definitely things that you keep track of too, but you really don't have a way of quantifying it other than saying that they feel better. So the main thing is getting yourself out there. And again, we're talking about on the marketing side, if you can show that these are the things that you're looking at to help the professionals that you're working with, if you can come into their clinic and keep track of these things too, that's the type of outcome that they want to present to their patients. It's like, this is how you were when you started. This is how you are now. Physical therapy does that. Blood tests do that. So any place you go where they do blood tests, it's a before and after. And again, I always talk about chiropractors. Auto accidents, we do a re-exam every 30 days so we can show that there's been an improvement, or if there's not an improvement, why, so that we can move forward and fix that too. So as far as mechanism of injury, is there an injury, an infarct? So is there like tissue dying as a result of their injury? Is there swelling? Is there pain? Stiffness? Has there been a re-injury for an older injury, like a re-spraining of an ankle, or it was their second auto accident in a year? So, now you're dealing with the re-injury of damaged tissue already, and scar tissue does not heal well, especially re-injury of scar tissue. Because the thing with scar tissue is, if it's allowed to heal and create a major scar, there's no blood supply, there's no nerve supply to scar tissue. It's like an aplastic system. And then you like when you take a ligament and you tear it, it's gonna scar itself together. But if you take that scar and rip it, there's really nothing to attach. There's no bleeding. There's no no triggering system to go in there and work it. And again, those of you that use PEMF for this type of a thing, it will help generate stem cells in that area, which is ideal for healing, and also to improve blood flow in the area as well, which is what you need. So again, these are kind of the precursors to keep track of. Is there an injury? Is there swelling? Is there pain? Is there stiffness? Was it a re-injury? These are all things to track when you're working with somebody on a consistent basis. And again, it hinted about it, but is it acute? Is it chronic? Those are some things to ask too. So is it a brand new injury, or is this an old injury? So in our world, acute injury, we want to ice it to control swelling. If it's chronic, we want to heat it to bring in blood flow. So the person that wakes up, they're in their 70s, their low back is stiff just from life. Heat is a good thing. It warms it up, gets things moving. So it takes like a hard plastic and turns it into a supple rubber, or like clay. Clay, when you get it, is really hard until you start working it, and then it gets really stretchy and moldy. That's what heat does to the human body. But again, if it's been injured, if you can control swelling, slow down swelling, it's going to heal better, because swelling sometimes impedes the healing. And then you start working at, okay, if it is an acute thing, or it can be a chronic thing too, but what kind of a session program do you want to be on? Is it daily? Is it 3 times a week? Is it weekly? Is it monthly? All 4 of these are viable session protocols. Somebody can come in daily. Somebody can come in 3 times a week. Somebody can come in weekly. Some people can come in monthly. These are my patients. They're on these types of programs. It's just based on what's going on and what kind of a deal that you want to get through. So one of the things I have in my mind when I'm talking with patients is they'll ask me, like, what should I do? And this is the kind of the type of system I have in my brain, is that the more frequent, the faster the results. So with time to rest, of course. And I'll tell my patients, if you're working out in the gym and you want to get really good results quickly, you don't want to work out once a month. You may not even want to work out once a week. It's either 2 or 3 times a week that's going to get you there the quickest. So I look at PEMF that same way, as the more frequent that you can apply, and the longer the sessions, the faster things are going to happen. But the caveat is having that time to rest in between, because there's a detox. Same thing with working out. You want that time in between. You don't just continue to work out 8 hours a day daily for a month without there being some kind of a tissue breakdown as a result of it. So the body does need time to heal and rest. And with PEMF, of course, that has to do with flushing out toxins. And Probably the biggest one too, you may have already encountered this, is they feel really good, so they start taking on too much and the tissue itself's not healed yet. So that might be a re-injury. Probably my biggest issue that I had with somebody is they came back, they were really mad at me. They were limping, they were coming in for knee care. So we were working with the knee, and it had been probably 2 weeks. They're going on vacation, so they didn't want to have a bad knee when they're in Europe, bad vacation. So I had them coming in every day doing 20 minutes on the knee, and then they were doing really well, and then they came back and they're like just so mad, limping. They're mad at me. They're going, "What did you do? You told me this was going to work," and just all of this stuff going on and on and on. And I'm thinking, I've never seen this happen before. What happened? In my brain, it's like, I've never ever had a bad reaction with PEMF. Turns out she was also seeing a trainer, and that the trainer had to do deeper knee bends because the pain was disappearing. And then she didn't want to tell me that. She just wanted to yell at me. And then when I found out what was going on, it's like, why didn't you tell me this? This is what happened. Your trainer forced you to go deeper than I would ever have had you go. Are they a physical therapist? Why did they have you do that? Well, because my knee wasn't bothering me. It's like, I'm not the one that screwed your knee up. You screwed your knee up. And she was the type of person that didn't want to take blame for her own actions. She needed somebody to yell at. And she liked her trainer and didn't want to blame him for having her go too deep. So once we figured that out, then it was like, yeah, you became your own worst enemy. So those are some other things to think about, is to make sure that they themselves don't put themselves in a position where they're undoing the sessions that you're doing for them. So again, it's one of the ways to do this is to measure the changes, and also the same thing with measuring where the placement is, measuring what the power is, measuring what attachment you're using, or not measuring, but keeping track of that, what the session time is, and pre and post measurements. So those are things that you need in your little bucket on your sheet of paper for that person, so that as you're coming back, you can do these spot measurements if you want, or you can do it on a weekly basis. Everybody's a little different. When you first start out, or if the person's new to PEMF, it might be something that you test, every time, so that they can see the mild changes too. Usually in my settings, it'll be on a weekly basis, because the changes then are pretty obvious. So they've got, an extra 10 degrees of range of motion, and they can feel it too. But those are some things to think about. And again, proof of improvement, as far as okay to begin, active, passive, range of motion, tracking those changes. So there is different types of sessions that we do. So there's passive, where you just place it on the area. Active is where you're having them move the area inside the PEMF, but then also measuring that range of motion when they're doing it. But another thing with active, passive, and range of motion too is active is where they're bending it and you're measuring it. Passive is where they're relaxing and then you're bending it. Sometimes them engaging the joint while they're moving it can hurt them if they're doing it, which means their muscles are engaged in those kinds of things. So it's important to make sure that when you are doing these things, that you are consistent to show change. You don't have to be consistent if you aren't marking any of these things down. But if you're working with somebody and you're working for somebody, like a doctor, or even on the animal side, so a vet, if you can show these changes and they are consistent, like every time you do this, it's for this amount of time, this is the device, this is where you place it, this is the power, and you're seeing those changes, then you're creating your own database of when somebody presents an elbow pain, it's like, okay, well, this is what I've done in the past. This is the protocol that we're going to use. So by you staying consistent, you can develop your own protocols too. So here's a quiz. I haven't done this before, but here's our quiz. So is this okay? 5 times a day with 30 minutes each time. Could you do 3 times a day with 60 minutes each time? Could you do 3 times a week with 15 minutes each time? Could you do 2 times in a day in 15 minutes each, or every week for 4 weeks? So 2 times in a day, 15 minutes each, and then every week for 4 weeks. Could you just do once for 10 minutes? The answer is you can do any of those, believe it or not. And for me, I damaged my shoulder in Hawaii. I got picked up by a rogue wave, and then my body got twisted while my arm got to stay. So weird, like locked in the wave while I twisted. And I was walking with my shoulder down, and I couldn't lift it. And it was the craziest thing, but I had a PEMF. It's like, okay, as soon as I get home. And so that's what I did, is I did 20, 30-minute sessions 5 times a day, and I did it daily. And within a week, I had full range of my shoulder back, and the pain was far diminished. Of course, I used ice. Of course, I used heat. But I also, with that PEMF, I would set it in the same spot. And for me, because you can feel where it is. It's like, how people say, it goes right to my pain. It knows right where I hurt. The reason is because anything that's inflamed and tender is going to be more sensitive to it. But from the person's point of view, it's like, how did it know how to go there? It's like, it's going everywhere. It's just that the place that's sore is experiencing it more. But what that means for me and with my patients is we'll place it and it's like, I don't feel it anymore. Then we'll move it. But then also I was doing active care too, and with weight. And those are some of the things we go over in our membership area. So all of these work, believe it or not. It depends on what you're going after. So what is your goal for PEMF? Again, is it for wellness? Is it for changes? And again, what is the outcome for this PEMF session? To feel good or to have tissue changes? And then again, to measure these changes based on your placement. If somebody's getting better and you're consistent with all of these things, then it's what you're doing. If you're moving it, down the arm or to the shoulder or to the elbow, and you're moving it all over the place, you don't really know how much of an impact what you're doing is helping them with. And so same thing with protocols, you're working that same spot. My advice is to write down the sessions, to track changes, and then also to schedule a frequency. And if somebody's acute, PEMF is definitely going to help them. If it's if you hurt yourself and you're using ice, that's 30 minutes on, 30 minutes off, and do that as many times as you can every day for the first 3 days. That's the schedule frequency for using ice on an acute injury. That's for the first 10 days. And then after 10 days, you're alternating ice and heat for 3 or 4 weeks. And then at 6-week period, you're just using heat. So that right there is the treatment protocol for ice and heat for an acute injury. If it's just a chronic, then it's just heat. But my point is, that's already been addressed, and that is a system. PEMF is, again, we're kind of in the new frontier here. It's like, well, what do we do? How long do we do it? For me, it is let somebody try it for 10, 15 minutes, see how they feel. If they notice a difference, then I would like them to have a noticeable difference on a high frequency level. So if they could come in daily, and if all they're doing is PEMF, I don't want them to waste their time driving 20 minutes for 10 minutes of treatment or sessions for a 10-minute session. Or, is that all that they can stand? Or what's the power of the level? So I make an assessment based on that. Usually I'll have somebody, if they're coming in 3 times a week, I will have them set up for 20 minutes. and I start them on low. And as we get going, we can adjust the power so that they're getting more. I have people that have been doing it for a year and they're not past their power level. It's still, if I go any higher, it's irritating to them. So, but they're moving better. Unfortunately for them, they're kind of the same thing. How come you're hurting? Well, I went out and power washed my front deck today. Well, why'd you do that? Because I felt so good. Yeah, but look at you. You're hobbled over again. And so those are some conversations you may have. Okay, winding down. Again, thank you for hanging out with me today. And the goal here is on our Ask Dr. Jerry's Best Practice series is to go through some of the top things you've been asking us for. And the consistency, again, is the key. The other thing is, hey, Rob, thanks. Yeah, you're welcome. I'm glad that we are here to help you out. It helps us move along with our membership too. But again, our best practice series is all about what we can do to help you out. And there are lots of ways you can help us out. One is, get a hold of us and request our newsletter, In the Loop. And we go through every month some of the great things that are going on, the political stuff we're working on, where we're moving forward with our website, all of the great specials and deals we have inside our membership area, getting certified in not only PEMF, but also red light therapy, and then all of the marketing tips and things that we've got too. You can like and share this video today. You can go through our previous ones and like and share those over on YouTube. We're there as well. As I said, it helps our algorithm. If you can click on those, help grow our membership. There are a lot of people who have PEMF machines or thinking about getting one and don't really know what to do, or again, how to do it correctly. Manufacturers, some of them will have, here's how you plug it in, here's how you turn it on, and that's it. Others have educational series that they do. There are other ones that use our system, our certification process, to go through to get certified. And we are in 17 countries, and we've got a few places over in Australia. They use our training protocols, which has been great. So again, if you have a device that you're using that never came with any training protocols, we'd love to talk with the manufacturer, see if we can help integrate our system into theirs to help them help you be better PEMF users. Again, we have a members only on Facebook. I'll be jumping into that right after I'm done broadcasting today. So if you have any questions, you can do that. You have to be a member to get in. If you are a member, you just need to go to our location and just ask to be invited in, and we'll make that happen too. Those of you that are on the website, you've probably seen our code of ethics, but this is who we are, why we do what we do. And as we approach the end of the year, we are in the process of getting our nonprofit set up, which is awesome. That'll help us get into a lot more areas that we're hoping to delve into. And then also, let me jump back up onto our newsletter. You may have seen that little flash there, but we have PEMFCon, our PEMF convention, coming October 16 and 17. And we're in the process of getting some really good speakers for this. So I'm not going to mention them yet because we want to, if we can get all three of these speakers at the same time, then we will be jumping in and popping that in there all in one announcement, and we'll get that out to you too. Hey, Hazel. Hello. Thanks for jumping on. Good to see you again. And again, I want to thank you. And if you have any questions or tips, info@pemfprofessionals.com is where you go. If you're thinking about being a member, you can ask us questions there as well. But again, if you're ready to do it, it's very inexpensive. You get to do 2 certifications with your membership. You get the membership portal, all of the goodies we have inside there. Also the membership site on Facebook, you get to be part of that too. So thank you very much for your time today. I look forward to seeing you next week as we continue our series. And with that, have a great rest of your day. Thanks.